Glykopeel is the first medical peel with sequential pH variation acting specifically on signs of skin aging and skin imperfections. It comes in 4 concentrations: Glykopeel 20% with 20% of glycolic acid and pH 2, Glykopeel 50% with 50% of glycolic acid and pH 1.8, Glykopeel 70% with 70% of glycolic acid and pH 1.6, Glykopeel 70% max with 70% of glycolic acid and pH 0.8. To potentiate the action of glycolic acid, Filorga Laboratories have developed a formula of 18 ingredients for a complete anti-aging action. Exfoliation, thanks to the buffered pH glycolic acid to ally safety and efficacy. Protection, through the anti-free radical and anti-inflammatory action of mulberry, brown algae and vitamin E. Stimulation, thanks to vitamins A and C, with preventive and corrective action of aging. Correction of superficial pigment spots through the action of a powerful depigmenting cocktail, formulated with kojic acid and bucerol, regulating and reducing melanin synthesis. Glykopeel requires no social eviction. It can be done on every type of skin, even the most sensitive, all year long. Glykopeel improves immediately and visibly skin condition. It decreases wrinkles and fine lines depth, diminishes brown spots, regulates microcystic acne, improves skin surface, and gives radiance to dull and uneven complexions. Superficial peels are part of our therapeutic arsenal and are the first indispensable act to maintain your skin. Patients want to erase nasolabial folds, marionette lines, or frown lines, but also want a healthy-looking, brighter, radiant skin, and also want to erase blackheads, tighten pores, and provide uniformity of the complexion. All these items can be improved thanks to chemical peel techniques. Peel is a technique adapted to women with different needs. For women who are already into aesthetic procedures and who want to improve the brightness of their complexion, but it can also be starting point for younger patients who have suffered from acne, for example, who have small marks they wish to erase, or for young women who have a dull complexion and want radiance. To carry out a superficial peel, there are certain rules to respect and certain precautions to take. First of all, you should never have a peel done a few days before sun exposure. Also, when taking isotretinoin-type medication for acne, you shouldn't have a peel done during the entire duration of medication or even 6 months after the end of the treatment. It is also important to inquire about possible patient herpes reactions and possibly even pre-medicate 48 hours before the peel. Today we are going to carry out a dermatological peel on Elizabeth, which is a second peel. The first one was done 10 days ago. It was a 50% glycolic acid peel. We are using Glykopeel, developed by Filorga Laboratories. All chemical peels, regardless of their concentration, come in a box like this one, holding all the products. There is a pre-peel solution with a pH of 4.5, which prepares the skin to the intensity of the peel, 50% in this case. There is a post-peel solution to increase the pH to 8. Finally, the isotonic mist, which even after a peel restores the skin's pH to 6.5. Inside the box, you will find a small measuring beaker with swabs used for the peel. Elizabeth's skin has been cleansed beforehand, We can then apply the pre-peel lotion to a clean, dry skin. The beakers have a measuring scale. We use one measure for each patient. We use disposable swabs. We dip them in pre-peel solution and apply to the skin. We will avoid applying the peel to the small lesion you see here so as not to burn the skin. There is a small erythema on Elizabeth's face, nothing to worry about.
Voilà.
We have done the first half of the face, and now we will do the second half. The pre-peeling lotion has now been applied to the whole face. We are ready to apply the peel solution. We used a 50% peel 10 days ago, and the skin reacted well, so we can now use a Glykopeel 70% max. We add another dose of peel in the small beaker. We use the same swab. And start applying the same direction as the pre-peel lotion. A tingling, burning sensation should be experienced. But it is usually very bearable. Are you okay, Elizabeth?
On évite bien sûr d'en mettre dans les yeux.
We obviously need to avoid the eye contour. And now, we have completed the whole face.
La totalité du visage. On attend quelques minutes.
We wait a few minutes. Depending on the skin's reactivity, we usually need to wait 2 minutes, sometimes 3 to 4, up to 5 minutes maximum, to manage to lower the skin's pH required for this peeling. You need to pay attention to slight changes in skin color. There is a small erythema on the cheekbone and on the chin, but there isn't any damage to the epidermis. You also need to listen to the patient. She will let us know if it stings, if it burns, if it's bearable, or if the burning sensation is overbearing, in which case we can remove the peeling if symptoms are too unpleasant. How is it going, Elizabeth? Are you okay?
Ça pique et ça brûle.
It burns.
Au niveau du menton, oui.
Voilà.
Essentiellement.
So, as we notice, the chin is the first zone to react to the shock of pH. This zone will therefore require the post-peeling lotion applied first to neutralize the solution. Glykopeel post-peel cloth pads are ready to use. We apply them immediately to the zones requiring neutralization. We had noted that the chin was where the skin was the most red. We can even leave the cloth pad on the cheek like so. Are you okay?
Un peu dans le cou aussi. Voilà. Merci.
There you are. How's your skin? Does it still burn?
Non.
C'est bien, vous êtes bien. C'est juste un
No?
petit peu,
Better?
un peu chaud.
Non, même plus.
Donc la neutralisation
Immediate neutralization provides immediate relief.
La peau est
The skin is harmoniously colored.
colorée.
There is homogeneous
Il y a
erythema,
un érythème homogène. Et on peut considérer
and you
que
can consider that there won't
il y
be
aura
any
strictement
side
aucun effet
effects.
secondaire indésirable. Et on termine avec la brumisation.
We finish the session with the isotonic mist, which restores the skin's natural pH to 6.5. Close your eyes
On pulvérise cette brume
We spray the
sur
mist
la
on the
totalité
entire
du
face.
visage. On fait ensuite comme ça.
We do
Parce que
this
ça
so
permet à
that
la
the skin
peau
keeps
de continuer à
absorbing the
absorber la
mist
brume
without it dripping down the face.
sans que celle-ci ne coule ailleurs. Un autre
Another on this side.
Voilà. Et le
And the
dernier
last one
sur le front.
on the forehead.
Voilà.
There you are.
Alors, la brume est
Patients always
particulièrement
appreciate the
appréciée
mist
parce
because
qu'elle
it
sent très, très
smells
bon, elle est
nice
apaisante.
and it is soothing.
Et immédiatement,
The
la peau
skin
retrouve le
immediately
confort
regains comfort it needs
qu'elle
after the
attendait
intensity
après
of
le
the
choc du peeling.
peeling.
Voilà. Ça va?
C'est très bien.
Parfait. Merci. Après avoir
After having waited for the
attendu
mist
que
to
la
dry
brume
on the skin,
sèche sur la peau,
we
on
apply
applique un
a
petit peu
little
de
bit of Neosica,
qui permet
which
à
will
la patiente
rehydrate
d'être
the patient
hydratée,
and
également,
also
si elle
allow her
avait
to apply
envie, de
makeup,
pouvoir se
if she so
remaquiller dans les
desires,
heures qui
within a
suivent
few
cette
hours
séance.
after the session.
Maintenant, en général, les patientes ne se remaquillent pas parce qu'elles
Patients
ont
don't usually
une
put
luminosité
any
et une
makeup
couleur
on
de peau après le
afterwards
peeling
because they experience a bright and
qui
healthy-looking skin,
suffit
which beats
à
any
remplacer
foundation
n'importe
or
quelle
tinted day cream.
brumine, fond de teint ou crème teintée. Alors,
Neosica
a
also has the
l'avantage d'être
advantage
également
of
une
being a
crème
repairing,
réparatrice
soothing
en fait.
cream. Traditional peelings lower and increase the skin's pH in a very sudden way. With Glykopeel, the first peeling with sequential variation, Filorga developed a peeling into 4 phases, which allows a very gentle and suitable treatment for all skin. The pre-peel solution lowers the skin's pH to 4.5, the peel solution lowers it between 0.8 and 2, depending on the chosen concentration, the post-peel neutralizes glycolic acid up to pH 8. Finally, isotonic mist restores the physiological skin's pH. XHA Cube is the first polyvalent cross-linked hyaluronic acid dermal filler. It was conceived to fill medium and deep wrinkles, lips contours, and lips volume. Its exclusive and adapted formulation suits all cutaneous depressions that appear with age. XHA Cube is a monophasic implant cross-linked with BDDE. Its optimal concentration of 23 milligrams per milliliter combines cross-linked and free hyaluronic acid to ease injection and increase remanence. Its molecular weight of 2.5 million daltons is the highest one can get with biofermentation hyaluronic acid. Highly purified, it presents a perfect biocompatibility. Thanks to the dynamic sculpture technology developed by Filorga, XHA Cube has a unique and efficient viscoelastic behavior, allowing a dynamic filling adapted to all depths. Volume. The viscosity in XHA Cube was developed to maintain volumes through an adapted reticulation level and high molecular weight, thus making it more resistant to modeling. The controlled viscosity and fluidity in XHA Cube makes it the highest modeling capacity on the market. It enables easy and harmonious positioning in the most superficial tissues. Moreover, the exceptional homogeneity of XHA Cube hyaluronic acid allows a safe and controlled injection as well as natural and harmonious results granted for each syringe.